Welcome to another episode of the Zero Five Podcast. I'm your host, Mike Abernathy, and I have to apologize to you. If you have been following our series on the most underrated skills in church safety ministry, this week, I was supposed to release part 4, which is going to be de-escalation, and I had a great podcast planned for you. I had a special guest, John Riley from Gentle Response LLC. John is probably the figurehead of ministry-based de-escalation in the country, and had him on, had a great podcast, and I messed up the recording, and so the sound is messed up. There's a lot of reverb, and so I'm trying to get that fixed. We may have to do a re-recording of that. So I just apologize ahead of time. If you were expecting another part of that series, it's going to be delayed for now. So today, what I would like to talk about is maybe not necessarily an underrated skill set in church safety ministry, more of an undertrained skill set. And I want to talk about medical skills and about your medical kits that you have at your church. And so I've seen online a lot of churches talking about, hey, I'm looking to buy a medical kit, or I'm looking to stock a medical kit. And a lot of the input that those people get is tourniquets, chest seals, all of this stop the bleed type stuff, trauma kits. I know a lot of churches that basically the only medical stuff they have are trauma kits and AEDs. That's it. And that's all fine and dandy, but you have equipment that is gearing you up for the bare minority of events that's going to happen. You're preparing for the absolute worst case scenario, which you absolutely should do. But you don't have anything for the day-to-day stuff that you're most likely going to respond to. And as a church safety ministry, you are much more likely going to respond to a medical situation than you ever are an active shooter event. And those medical situations are likely going to be something well below a heart attack or a cardiac arrest. And so we need to be gearing our kits and our training for the stuff we're most likely going to see, because that is part of the ministry, is it's being able to respond to just about anything. A lot of families and also senior citizens, they're looking for churches, and they feel comfortable in a place where they know in the back of their brain, all right, there are qualified and trained people here if anything pops off. If I drop my kid off in this preschool and something happens to my kid, if my kid chokes on something or scrapes their knee or whatever, I know that there is somebody there that is going to help my child out. In fact, in the state of Texas, in daycares have a lot of training that the daycare teachers must go through medically before the daycare can open up. We don't have those same requirements on the church side, but it's a similar aspect in that people are dropping their kids off in our care. So we probably need to be trained to take care of them if something happens. Okay. Also, our senior citizens, they want to know that if they have a medical situation, that somebody is there to handle it. Now, in the churches that I've dealt with, that I've consulted with, or that I've talked with, and stuff that I've seen with church safety members online, is there's a couple of ways that churches run their medical response capability, those that have a true medical response capability. Some churches, they leave it purely up to their medically trained or medically licensed personnel. So your doctors, your EMTs, your nurses, your paramedics, those folks, they just say they'll handle it. And that's awesome. That's great. It's better than nothing. But what happens when those people aren't at church? Or what happens if they're on the complete opposite side of the campus or the building from where the incident is happening? Something to consider when you run that method of emergency medical response. The way we run our team at my church is I do have medical responders. We call them medical responders because they are trained and licensed in a medical profession. So doctors, nurses, paramedics, EMTs, firefighters. And so those people, they're on a radio with a separate radio channel, so they don't have to hear all the same radio chat as all the guys doing the security side or the response side. And they're on standby that if we have a significant enough medical event, they're ready to respond. The rest of my team, however, is trained in CPR. They are trained in above average first aid. And then they're trained in stop the bleed. And the reason why I do that is because I have many more safety team members than I have medical responders. And I have my safety team members scattered throughout our campus versus my medical responders they're going about church as their normal day, their normal Sunday or their Wednesday night. And if something happens, I have a safety team member that can respond immediately. And what I teach my safety team members is I teach them, you have 3 lanes that you're going to run in. You have to choose a lane based off of what you get from your patient. Is this a lane where I can handle this with my above average first aid skills? Is this a lane that if I call a medical responder, our medical responders can handle this situation? Or is this a lane that I need to immediately call 911 right now? I teach my safety team members to pick one of those 3 lanes based off of what information they're getting from the patient or a bystander. And then once you're in that lane, start working in that lane. So if it's a basic scraped knee, child, fell off the slide or whatever, that's well within a first aid situation. So I teach them, apply your first aid. If it's somebody's having a little bit of chest pain and you're trying to figure it out why, but you don't know, call a first responder. Some people will say if there's chest pain, automatically call 911. I tend to go against that because one, you're going to create a lot of commotion when you bring in an ambulance. And it may be something as simple as heartburn. It really can be. It can be something as simple as heartburn. Let's let a medical responder who is trained in that medical mental matrix to start working down that matrix to determine, this is more than heartburn. That's how we operate at my church, is we try to minimize disturbances. We try to minimize the embarrassment of having paramedics and firefighters show up to help somebody. It can be embarrassing for folks. And so we try to minimize that. And then of course, if it's something where somebody's having a seizure or it's somebody has collapsed unconscious, that's an automatic 911. So that's what I teach my safety team members, how to decide which lane this situation falls under and operate within that lane. So that is something to consider for your safety team. On Sunday morning, there are some medical calls that you are very, very likely to see at some point. And so these are things that you need to be training your team on. One, if you have kids, there's going to be bumped heads. They're going to fall down and scrape their knees. They're going to get little boo-boos that require Band-Aids or ice. And so teaching your safety team members how to look for potential signs of concussion, how to tell the parents, hey, your kid bumped their head. These are the signs you need to look for. If you see any of these signs, maybe take them to the ER to get looked at. And then how to put ice on a kid and how to put Band-Aid on a boo-boo and make them feel better. All right, Band-Aids fix a lot of owies in the kiddos. So teaching your team how to do that. Another thing you will very likely run into are people passing out. Okay, especially depending on how long your worship goes. If you're standing for worship the whole time and somebody locks their knees out, there's a high possibility that they may faint on you. And so learning how to identify, is this because they locked their knees out? Is this because of something more serious? Teaching your team how to work those things. Diabetic emergencies. How to identify a diabetic emergency and teaching your team how to work that problem. That is also something that you're very likely to run into on a Sunday morning. Think about it. Your diabetic person, maybe they're rushed that particular Sunday and they skip a breakfast and go to church and their blood sugar runs low. That's a high likelihood that you may see at church. So be prepared to handle that. How do you handle that? And so as you find training for your team, focus your training, ask your instructor to focus on training that you're most likely going to see on a Sunday morning or a Wednesday evening or Saturday evening, depending on when you have your events. Ask them, hey, what are we most likely going to see with this population at this time? And train those things. Also, it is very, very important for your team to be trained in CPR. If your team is not trained in CPR, I highly encourage you, get training in CPR. Now, here's some advice on when you seek training. Don't get trained by anybody, just anybody, okay? There are a lot of well-meaning CPR instructors out there, and I'm not trying to bash these people. I'm just trying to give you the best bang for your buck. Find a CPR instructor that has actually performed CPR. Okay. Again, I'm not bashing the well-meaning instructors that haven't done it, but there are some nuances about actual real life CPR that if you've never done it before, you're not going to be able to convey that as an instructor. And that if you have done it, these are things that you want to convey to your students. That's when I teach my CPR classes, I always tell my students, listen, I'm going to talk about some things that are kind of gross, but these are things that you can expect in a real life CPR. So that way, if these things happen, don't be shocked. Don't think that you just killed this person. Don't think that you broke them. No, these are normal. And here's what to expect. If you see any of them, just keep on going. If you don't have an instructor that has actually done CPR or experienced CPR, you're not going to get those nuances. And what I've seen many times responding to cardiac arrest and the bystander has stopped CPR or started and then stopped, it's typically because something happened and they thought, I just killed this person. When that wasn't the case, they were actually helping out and doing a good job. One of those things would be the breaking of ribs. If you're performing CPR on somebody and you're doing it correctly, you're going to hear snap, crackle, pop. And I teach that to all of my CPR classes. If you hear snap, crackle, pop, good job. That means you're doing it correctly. Keep on going. If you don't hear that pop, it may be because maybe you have a younger patient. It may be because this isn't their first rodeo. Those are things to note to pass on to fire and EMS when they show up. You're not going to get those things if you have an instructor that's never done it before. So, word of advice, find an instructor that has actually performed CPR. Get trained in that. If you're going to have an AED on your campus, get trained in how to use that AED and actually get practice on applying an AED. It is a nuanced skill set to be able to cut a shirt open while CPR is going on and then apply AED pads while CPR is going on. All right, that is a team event. And so if you're not training that as a team, it's going to be mass confusion if you have an actual cardiac arrest and you're trying to respond. Right? So find trainers that will teach you those nuanced things, that will teach you the teamwork aspect of doing CPR and applying the AED. Get training on those things that you're most likely going to run into. Focus on that training and then do additional training on the stuff that it's probably going to be a low occurrence, but it's high stress if it happens, right? So that's getting into your stop the bleed training. That is getting into more severe things like strokes, potential heart attacks, other things like that, overdoses. That's something, depending on where your church is located and what the population is in the area surrounding your church, learn how to treat overdoses, learn when to and how to administer Narcan. Again, seek training from somebody that's done it before, because there are nuances with medical stuff that you're not going to get from somebody that's never done it before. Okay. Like Narcan, you can't just press the Narcan button. You have to press firmly so it aerosolizes. Otherwise, the Narcan's not very effective. You won't get that from an instructor that's never done it before. They won't understand how that works. They'll be able to tell you what to expect if you give Narcan to somebody, what's going to happen. Your mileage varies on that one. Okay. So seek training. build your team's knowledge and skill set, help them to understand what their lane is and how to operate inside that lane. Also, if you're going to do medical response training, it's a good idea to have an awareness level training on what laws in your state exist to protect them if they respond. So here in Texas, we have a very broad sweeping Good Samaritan law. So I teach my team, like, listen, there's a lot that you're able to do that falls under the Good Samaritan law. So don't hesitate to help somebody because this Good Samaritan law protects you. Also in Texas, we have other laws that protect safety team members if they're operating within the scope that the church has allowed them to operate. And so have that scope, define that scope for your team and say, you can operate within these parameters. That gives your team and your church a little extra protection to operate in case something goes wrong or in case the situation was more severe than you thought. All right. But again, these are things that your team needs to be aware of, that you, if you're a safety team leader or a church leader, these are things that you need to be aware of. So look into those type of things. Finally, once we have the training in place, we need to build out our medical kits to help us in our medical situations based off of our training, right? So not just stop the bleed trauma kits. We need to have actual medical kits that have ice packs. They have Band-Aids. They have thermometers. They have glucometers to test somebody's blood sugar, right? If we're going to potentially run into a diabetic emergency, it might be a good idea to be able to and know how to test somebody's blood sugar so we can help with that prior to EMS getting there if we even need to call EMS. All right. I teach my team how to take vitals. So they learn how to take blood pressures. They learn how to take a pulse. They learn how to read a pulse ox. They also learn how to administer oxygen. And the reason why I do that for my team is that if it is outside of basic first aid and they bring in a medical responder, the medical responder is going to be running that medical mental matrix through their head, and they're going to be making decisions based off of their experience, what the patient is giving them, and what a bystander may be giving them. So what they don't really have time for or mental bandwidth for is to be taking vitals and trying to process this stuff. So if I can have a team member that can take vitals while the medical responder does their decision making, that just makes the scene, one, it makes our team look a lot more professional. Okay. It is a lot more professional response, which adds to adds to the comfort level of your congregation members when they see your team working as a team like that. Man, I tell you, it has happened so many times where we've had a medical incident and bystanders came up to me afterwards as the safety team leader and said, man, like that was, you guys handled that really, really well. Like I did not expect that. And when you get that from your congregation, that shows that now there's a level of trust in your ministry that, okay, I really don't have any issue with okay, yeah, these guys are armed, but they're here to help out. They really truly are here to help out. That is something too that helps your church leadership and helps you when you talk to your church leadership about maybe we need funding for training, maybe we need funding for training equipment. When you actually exercise your ministry and you look professional in doing it, it makes a world of difference. Okay. So that's why I teach my team how to take vitals to help the first responder. I teach them how to do very basic things like administer oxygen. So if we have a significant respiratory issue, which if you have children and they're having a respiratory issue, word of advice, call 911 immediately on that one. Kids and respiratory issues do not go hand in hand at all. So that is one of those situations to train your team. If it's a child having a respiratory issue, get 911 coming ASAP. And then we can work from there to help out as much as we can. So we carry albuterol in our kit. Now, my safety team members do not learn how to administer albuterol. I leave that for my medical responders because depending on their license, they're probably licensed and cleared to administer that medication. Whereas A normal bystander is not going to have that clearance. And so that's something to keep in mind, that if you're going to be administering any medications at all, make sure that the person administering them, that kind of falls within their scope of practice. And so aspirin, Tylenol, ibuprofen, Benadryl, those are things that a normal everyday person, it's an over-the-counter medication. Albuterol is a little bit different. Ipratropium bromide is a little bit different. And so those are things to keep in mind. So, but, this is all under the purview of, these are skill sets that we probably know we need to have, but we probably don't put enough focus on them. So start thinking about, all right, when we schedule out our training, whether you schedule it out by quarters or annually or semi-annually, schedule some medical training in there. Seek trainers with experience that are going to teach you the nuance of what's going to happen when you face this particular situation. Get your equipment that enables you to respond to such and such situation. Okay. But let's start thinking through our medical response. Let's not only gear up to respond to active shooters. All right. Yes, we do need active shooter kits, and that's going to be a whole other post, a whole other podcast that I'll talk about how to stock your active shooter kits. But in the meantime, if we have a limited safety team budget, let's spend it on things that we're likely going to use. I will tell you from my budget, the vast majority of my medical equipment is spent on Band-Aids and ice packs. We go through ice packs like there is no tomorrow. Part of that too is because we're in Central Texas, VBS, we get kids that get hot. We use ice packs to cool them down. All right. Also, you put an ice pack on a kid that's got an owie, they're going to feel a lot better. And that is part of our ministry. That is us helping that kid to feel a little bit better. So now when they go inside and they're hearing about Jesus, they're focused a little more on hearing about Jesus and less about their owie. Right. And so always keep that ministry mindset there in whatever you respond to, in whatever you train for. How is this going to enable my congregation to focus more on God and less on the situation? All right. Again, I apologize for not getting part 4 of our underrated skills in safety ministry. So today we're talking about an undertrained skill versus underrated skill. I'm going to try and get that podcast out to you, whether it's re-recorded or remastered. I'll get that to you soon. Also, if you are a Substack subscriber, we are going to be putting out some paywalled information on Substack, tactical information, in-depth medical discussions, in-depth firearms drills and training for the benefit of our paid subscribers. We appreciate all of our subscribers out there. We just wanted to express a little extra appreciation to our paid subscribers because they're helping us carry out this ministry. And so in order to express that appreciation, we're going to provide some more in-depth discussions to our paid subscribers. So if you're a subscriber and you want that more in-depth information, please upgrade your subscription to a paid subscription. If you're just browsing and you've come across our podcast or our Substack, please consider becoming a paid subscriber. I can't express enough how much that helps us in furthering this ministry of building safety ministries at churches and protecting our congregations. So thanks again for joining us. I look forward to talking to you next time. But until then, protect his people, give him the glory. Thank you for listening to the 05 podcast. I just want to personally thank you for your support, especially those that have paid subscriptions on Substack or have given us subscription-free donations. Your support is helping this brand new ministry get off the ground. For those of us here at 05 Safety Training, we're fathers, husbands, and we all work regular jobs. So your support helps us to have to work less overtime at our regular jobs and spend more time on this ministry that God has called us into helping you build a stronger and thriving safety ministry. If you're able, please consider a paid subscription on Substack or a subscription-free donation looking up 05 Safety Training on Substack.com. At the very least, please consider just sharing this information, sharing our podcast and our Substack posts with friends of yours or with other churches that are trying to build their own safety ministries. Thanks again for your support, and remember, protect His people, give Him the glory.